Well, imagine we are going to continue the conversation on COVID-19 and all matters related to coronavirus. My guests are in studio and they're seated already. Let me introduce to you Elvis Darko, who is the editor of the Finder newspaper. Elvis, good morning.
Good morning.
How you doing?
Oh, I'm good. Yourself?
I'm well.
Great.
I had a rather interesting weekend, but yes, I'm good.
I see.
How was yours?
Oh, I'm yet to start work, so I'm still enjoying my days at school.
I see.
Exactly a week today, the Finder will be back.
Okay.
We're supposed to return today, but then for some reasons, management decided that we start from the first week of May. So
okay.
From Sunday, I'll be busy. But for now, I'm resting.
It's good to have you here. My other guest is also seated, is Kwame Jantuah. He is a lawyer, and he's the former vice chair of PIAC. Good morning, Kwame.
David.
Yes.
How are you?
I'm fantastic. How are you doing?
Very, very good.
Yeah, it's good to have you here.
Good to be here.
Had a good weekend?
It was okay.
Decent.
May I say?
Yes. What are you going to say?
Today in history, it's exactly...
I know what you're going to say.
48 years...
Since he passed.
...of the death of Osajifo Dr. Kwame Nkrumah.
Mm-hmm.
And I believe he's been vindicated.
How? In what sense?
In terms of the way he planned this country, some of the things that he was putting in place. Some of the things that our current president is doing is following his footsteps. And I believe that if we had...
Such as?
Oh, 1D, 1F.
Okay.
Planting for food and jobs. He did all this thing.
Back then.
Unfortunately, he was overthrown. And for me, the crux of it is that some of the things that he put in place, if we had even left some of them there today, I don't think we would have been in the situation we are today, that we now have to struggle to manufacture PPEs in a time of pandemic. Okay. And so he's been vindicated. He was a Pan-Africanist. He led Africa into a new realm. Unfortunately, he wasn't able to achieve the economic independence that we were looking for. But I still believe and I still maintain, without any partisan politics being played, I still maintain that if we look back and go back to some of the things that he put in place, I think it will move Ghana forward. I mean, people complained about the Young Pioneer Movement, but the Young Pioneer Movement was to structure the youth so that they had some love for country and patriotism. And if you read the Young Pioneer Charter, you would see that if we are able to apply it today, it will help a lot of us. And lastly, can you imagine, he died at the age of 62. My age now. So can you imagine when he started?
Wow.
And so we must be grateful. Unfortunately, COVID-19 would probably stop any commemorations or celebrations, if we can call it a celebration of his death. But let's look at the positives and let's try to take party politics out of the leaders of this country that have been able to push this country forward. I'm sure in the next 15 years, people will be talking about Nana Akufo-Addo in a different light in terms of the good he did for this country. Let's celebrate our leaders and let's learn from them.
All right. Thank you very much for that. I think it's a fair call and it's an important one too. Well, let's begin the conversation. We're going to start with the case count that is now 1,550, 155 recoveries and 11 deaths. Now, just to put that also in context with where we find ourselves today, generally speaking, we have 11 deaths from COVID-19. But in reality, there are also other things going on, and I would like my guests to just quickly comment on them. We have 54 deaths from malaria within the first quarter, of this year, and then also cerebrospinal meningitis has taken 47 lives, 40 in the Upper West and 7 in the Upper East region. I'm not sure what your thoughts are. I'll start with you, Kwame. On the 54 malaria deaths across the country within the first quarter, and then also 47 CSM deaths from the Upper East and Upper West. What you make of this, juxtapose it to the pandemic we're dealing with right now? It's almost like there's a distraction, from some of these problems that have been perennial, and we've had to deal with them all.
Is it a distraction? Would you say it's a distraction?
I'm talking about COVID-19.
Yes,
seeming as though it seems to have taken center stage.
Yes, you seem to be talking of COVID-19 as a distraction from meningitis.
I'm asking whether it doesn't seem to have taken away attention of the country.
It's a very difficult thing to say. Malaria kills. Malaria can be cured. Meningitis, we know, kills.
Yeah.
We know it happens every year.
Yeah.
And if it happens every year, we should be able to plan for it. Unfortunately, this meningitis strain is a different kind of strain, so there's no vaccines, but they're able to manage it. The difference between these two ailments and COVID-19 is that you can't see COVID-19. You can't even feel COVID-19.
Yeah.
And it moves
like crazy.
It moves in an invisible way. Do you wear face masks for malaria?
Nope.
Do you wear face masks for meningitis? So why are we wearing face masks for COVID-19? Because we don't know who is infected, when they're infected, who can be infected, and there is no apparent cure.
Yeah.
And it can affect more people. Yes, meningitis is contagious. Is it contagious?
It is.
Yes, it is contagious.
It is, yeah.
Malaria isn't contagious. So far, how many people have died from meningitis? 40?
47.
47 people have died from meningitis in a concentrated area. I think we should have been able to make sure that every year we know there is infections of meningitis. We should have planned for it. The world was caught napping with COVID-19. It took everybody by surprise, which really it shouldn't have. Why do I say that? Because when it started in China, the whole world should have taken advice from that and start putting things in place. Albeit, we can say, when you look at the entire globe, Africa seems to have been spared so far.
So far. Fingers crossed.
Fingers crossed. Pray to God. So far, when you compare what is happening in European and Western countries as opposed to Ghana.
Yeah.
In fact, today I heard there's one country that seems to have eradicated COVID-19.
New Zealand?
New Zealand.
Yeah.
It's a small population, isn't it?
Relatively.
They have the same number of cases that we have. But when you look at the African continent, which you can place China in, you can place America in, you can place Europe in, it's a big continent. And the kind of numbers we have, it's impressive that we are where we are.
Yeah.
And so, in a nutshell, malaria is something that is with us all this while. And I expected that by now, Africa as a continent, where, and you get malaria in South America, you get malaria in Asia.
All the tropic regions, really. Yeah.
But Africa as a continent should have been able to devise a vaccine. I hope COVID-19 is a platform for our scientists and for investment to go into that field for us to be able to start looking after our people. Because really, we can't concentrate too much on Europe and America coming in. Can you imagine if we had millions of deaths of COVID in Africa? It would be splashed CNN, Sky TV and all that. Do you see it? No. No. That should tell us something.
Well, Elvis, before I come to you, I just want to read something quickly here. The mode of transmission of CSM is this. Bacterial and viral meningitis are contagious and can be transmitted through tiny droplets of respiratory secretions from an infected person during close contact, such as kissing, coughing, sneezing on someone, as well as sharing eating or drinking utensils. Now, think about it. So I think that in a certain sense, right, even the wearing of face masks that we are adopting in COVID-19 could actually help. And the whole practice of washing hands and making sure that we are more hygienic could actually help us even in the fight against CSM also. So,
well, I've been, as I said last week, a victim of CSM.
You said so, yes.
Yes, been a victim of CSM, and it's a terrible disease.
Wow.
Nobody should get it. If you don't, and you see, when it comes, it doesn't show itself.
Yeah.
And by the time you realize, you think you have malaria. And by the time you realize, it's taken you off.
Over.
So, yes, I think education should be rife in a lot of these ailments and diseases that we see on the continent, so that people would be able to understand these things.
Okay.
But before you pass on to Elvis, you know these face masks they've asked us to wear?
Yeah.
The government has put in conditions, and there's a law with regards to the type of face mask. Now, you see a lot of people walking around wearing local
fabric one, yes.
Who is checking? Because inadvertently, if they are not sewn according to the guidelines, we could be spreading COVID-19.
Okay, we'll get into that conversation a bit later. Let me ask Elvis what your thoughts are. CSM, malaria, vis-a-vis COVID-19. Are we going to benefit from the fact that we have experience in COVID-19, to also help us to fight these other ones as well? Or it's just creating a distraction for problems that are perennial?
Well, it's unfortunate that people are dying. And malaria and CSM, for instance, have been with us for some years now. So we know the season for CSM, and then malaria, we know what causes it. And it's unfortunate we are still seeing people dying from such ailments. It's just sad that this current strain of CSM is a new one that we are now trying to find a solution to. Because the previous one, we used to have a vaccine. So during the season, people are injected in areas that this thing to happen. But unfortunately, this new one, the existing vaccine can't work because it's a completely different strain.
Yeah.
So it's virtually like the COVID we are talking about, because coronavirus has over 6 strains, and is the current one that seems to be causing havoc because it doesn't seem to have a solution. And therefore, if you have a new strain of CSM, then every attention needs to be paid to it, because it may not be global.
Yeah.
It's only Ghana. But then since it's a new strain, we have to work harder with the speed that we need to work with. It's just unfortunate that COVID seems it's a new disease. It's a new pandemic. The whole world, no one seems to know exactly a particular way to deal with it. So there is this hysteria in the whole world, because the speed at which the disease spreads is scary. And when we look at how people are dying within a short space of time when they contract COVID, it's scary. So the whole world's attention seems to have shifted towards COVID. So it's not that it is justifiable that we are paying so much attention to COVID, which has killed only 11 people, as against malaria, which has killed over 50, and then CSM, which has killed over 47. It's because of the nature of the disease. In fact, the WHO last week warned that looking at the pandemic, the COVID pandemic, and the attention the world is paying to it, deaths from malaria could double this year, because we are paying so much attention to COVID to the extent that other diseases are not getting the attention they deserve. Yeah. So WHO has warned that if countries do not take care, malaria deaths, for instance, could double this year. So Nigeria has Lassa fever, which they have been dealing with for some years now. Yeah. Between January and March this year, Lassa fever has killed 774 people in Nigeria in 3 months. Yeah. But Nigeria is not talking much about Lassa fever, but they are talking more of COVID, because COVID seems to be the hysteria at the moment. And therefore, it's just unfortunate that, for instance, Nigeria can lose 774 people, yet not much is being said about Lassa fever in Nigeria. The whole talk in Nigeria is all about what? COVID-19. So I think that now that the world has started relaxing the measures, we as a country and the whole world should begin to also pay attention to other diseases that are taking lives, so that we don't end up fighting COVID and then realizing that at the end of the day we have lost more people that we could have saved because we were too much focused on COVID.
But yes, that's true. But I also think that it's important for us to learn from the public health approach that we have put in place for COVID-19. Because think about it. When you hear of 47 people dying of CSM, I've not heard any public health advisories as to wear face masks. Meanwhile, it's transferred by droplets. Do you get where I'm coming from?
Yeah, I'm getting it. And even face masks we are being asked to wear. It's just a trial, something we are doing to see whether it will work. Because nowhere in the world has it been proven that face masks have been able to prevent the transmission of
no, but it's logical.
No, it's logical, but medically it has to be scientifically proven. There must be empirical evidence that shows that wearing face masks can stop or can minimize.
All the countries that have had a dip, flattening of the curve and a dip in their case counts, all have implemented face mask wearing.
No, but it has not been established that there's data to show that because of face mask, that is why there's a dip. Everywhere in the world, there's no data that has shown that because of wearing face mask, that is why it has dipped.
Well, even if
that is why WHO, you have not heard WHO recommending wearing a face mask by the general public. It's not WHO recommending. It is countries that have decided that they think that it could help.
But the CDC
if there is no data for something, it's just a trial. And I said, because COVID is a new disease, we will do all kinds of trials. At the end of the day, we will gather some data that will show us that this one has worked somehow, this one has not worked somehow, so next time let's do it. So for me, the things we are trying in COVID, let's try as many as we can, because it is difficult for us to pinpoint that this is actually the problem. So for me, if they say we should wear face masks, I support it. But as you said, CSM has been with that for all these years.
Yeah.
If you what you read about the transmission mode of CSM, is the same as COVID.
Yes.
So why is that, as you said, why is that during CSM all these years? Medically, we have never recommended that. Now we are. So maybe from COVID, we'll learn our lessons and say, okay, the next time that there's a CSM outbreak, because data has shown that
it works,
face masks has helped, and the transmission mode is the same. Then now, if we have CSM, we want to try masks.
We'll come back after this break. Well, let's take a short break. We're going to be right back. Please don't go anywhere. All right, welcome back from that break. The news review segment is active and it's interactive, and the hashtag is Breakfast Daily. The WhatsApp line is 0550-585832. So if you happen to be outside the jurisdiction of Ghana, kindly use the country code +233. Now we are having a conversation about the case counts in Ghana now. I'm going to read to you a couple of stories, and then I'll engage my guests here. 21 more persons recover from COVID-19 in Ghana. Count now 155. 21 more people have recovered from coronavirus infections in Ghana. This brings to 155 the total number of recoveries in the country. This was confirmed by the Ghana Health Service on Sunday, April 26, 2020. All those who have recovered are those who were detected through general surveillance. Meanwhile, Ghana's case count has risen to 1,550 with 11 deaths. All right, so that gives a regional breakdown. In Greater Accra, we have 1,347. Ashanti region has 69. Eastern region has 57. Oti region has 17. Central region has 17. Northern region has 13. Volta region has 10, and so on and so on and so forth. All right, so let me read another story in relation to this. COVID-19 cases in Ghana increased to 1,550. Ghana's COVID-19 cases have increased to 1,550. This is according to the Ghana Health Service latest update on Sunday, April 26th. The updated case count comes after 271 more persons tested positive for the virus. Per the update, one more person has died while 21 additional recoveries have been confirmed. Some of the new cases were confirmed in the Oti region, Greater Accra, Ashanti, and the Central regions. Out of the 271 new cases reported, about 75 of them were detected through routine surveillance, while 196 were found positive through the enhanced contact tracing exercise. All right, the latest figures to came out with a total of 100,622 tests completed by the various testing centers across the country, including Noguchi and KCCR over there. All right, so let me start with you, Elvis. Are we winning this fight? What do you make of the current case count?
Well, I first of all, let me say that when you are sick of any disease, the expectation is that you will not die, you will recover. So, in the case of COVID-19, I think the main fear and focus should be the number of people who are dying from the sickness, wherever it is happening in the world, including Ghana.
Okay.
So, for me, we have almost 1,550 cases, and 11 people are dead. And I look at the rate, I think that we are not doing badly. Okay. Because if people fall sick and they will be healed and they will come back home, your family, everybody is happy. The only reason we all fear sickness is that you may die. Okay. So for me, I think that the case count going up, I am not much worried about that. I am more worried about those who are dying from the sickness. And globally, I think it's a standard that is being used to judge everybody. A case in point is Germany, where it's been accepted that globally Germany seems to be the star in Europe now in terms of performance, in terms of why? Because Germany can count for 154,000 cases as at yesterday, but the number of people who are dead are just a little over 5,000. But when you look at Spain, Italy, and even the US now, France, which have similar cases, as for US, the case is gone up. But if you look at the France, Italy, and Spain, if you compare to Germany figures, the difference of the number of cases is not much. But these three countries, their death figures have surpassed 20,000. So if you compare, you realize that if you are able to control or ensure that people do not die or the death numbers are lower, then it's considered that you are doing well in terms of addressing the issue in terms of this disease. So for me, when I look at the death rate of 11 compared to a figure of 1,550, then I have consolation that we are doing well.
Okay.
And this is because we are identifying the cases at the mild stage. It turns out that if you look at the data everywhere, those who go to the hospital at the acute stage, most of them do not survive. Okay. They end up dying. In fact, latest figures out show that almost 80 to 90% of people who are put on ventilator in a place like the United States of America actually died. They did not survive. So when the disease is identified in you at a very early stage, you are likely to survive. That is why WHO has insisted that test, and test. Because it is through the test that you can identify the cases at the early stages. And therefore, if you do that, then you can treat your people quickly for them to be doing well, and then reduce the number of deaths.
Yeah.
So when I look at our cases in Ghana, I focus on the number of people who are dying, and I compare to the figure. So I tell people that don't be worried if the cases are rising. And if those cases that are rising, the people are all at a mild stage, then we should be happy. It means that we identify the people at the early stages, and therefore treatment and their recovery is very high.
Okay.
But then when we are getting people at the time that they are almost in the acute stage, then it means that our death figures will go high. That is why I am advocating that the contact tracing is something that we must continue. And we must even go further to see if we can do a test for everybody. I was amazed yesterday watching an Al Jazeera story in which Senegal says they are testing everybody in the country.
Just walk in and get a test.
And they have developed their own test kits that is worth just $1. And therefore everybody the state can afford to test everybody. So people just walk in, whether you feel sick or not, even if you don't have any of the symptoms that you said, I still want to test for COVID. In Senegal, you are allowed to walk to any health facility and test. And I think that is one of the reasons Senegal has only 2 people dead as we speak and have a very high rate of recoveries. The whole of Africa, Senegal has the highest recovery rate. And I'm told that by percentage terms, if you compare even globally, they are about 3rd or 4th because they are making people to go and test. And therefore, they identify the cases early. So, for me, I wish we can have more test kits and test as many that want to test so that those who have it, we can identify early. If you look at the data from New York, they tested antibody test and they realized that with the results, it's about 20% of the New York population carrying the disease. Because many people are not sick, but they have it with them.
Okay.
So it's important that the WHO advice of test, continue. So I hope that we can even further expand the contact tracing so that we can trace the contacts quickly. The only thing I will say about the Ghana situation, which I'm not happy about, is that I've received several reports from people that have been tested, but for 1 week, I don't know my results. I think that if we can bring in test kits that can generate a result within the shortest possible time, it will reduce the time people have to be waiting to know their status. I think that is because once the person is tested,
you're referring to the rapid test.
The person is anxious. What is my result? And if you are keeping that person in that anxious state for a week, and the person doesn't know the result, I think that is creating another problem for us. So I wish that the next test kits will bring, we'll have the rapid test kit that maybe 60 minutes, 1 hour, the result is out. And therefore, people can know their results earlier than the 1 week people are waiting for now. That will be my only issue for now.
Kwame, what are your thoughts about our case camp where we find ourselves now?
I think, for me, looking at the number of people who have died, there is some good news in there. And what is the good news? If you listen to the president in all his addresses he's given, he indicates with regards to those who have died, they have died from related challenges.
Comorbidities.
Yes, comorbidities. All the 11. And for me, that's hope. That's hope. I haven't heard any of the medical staff, nor the hospitals, nor the treatment centers actually pinpoint that somebody actually died primarily from COVID-19. So for me, that's a good thing. Now, the one thing that has been, when I listened to the president yesterday, which wasn't clear to me, maybe either yourself or Elvis can clear it up to me, clear it up for me. From the 1,154 cases, which ones come from the backlog? Because we heard there was a backlog of what? 12,000?
Well, there's a backlog of 18,000. Really.
18,000. Which ones come from the backlog? Which ones are fresh infections? So that we can tell that most of these increases are coming from an already contact tracing from the people who came initially.
Yeah.
And if that is the case, then we can say that at least if we are targeting the next phase of attacking the virus, we know where to go.
Well,
Now,
let's put this into context a little bit. I'll let you speak. So at the time when you mentioned the backlog, we had done 86,000, right?
Yes.
And they were saying 18,000 were left, right?
Yes.
And majority of that were basically a backlog, right? Now, since then, we've crossed 100,000, which presupposes that they pretty much mopped up the backlog, So right now, what we're probably dealing with would be, but then the issue again, which is I know is a major concern for all of us, is how much are we dealing in terms of real time cases, and the spread. So
when in the statement, and you actually, when you were reading, and I jotted it down, you indicated the surveillance has been encountered. It's been a general surveillance. What is meant by general surveillance?
Okay, so general surveillance is people are walking in, and saying that I'm not feeling fine. I'm not feeling good. So that's one. And then there's the enhanced contact tracing.
Let me give you the figures here. Routine surveillance, the total test is 21,047. The positive cases were 513, which represent 2.44% positive rate. Contact tracing, 77,553. 922 tested positive from the 77,553, which is 1.19% positive rate. Mandatory quarantine, 2,115 tested positive. So if you're asking about the contact tracing, the 77,553 have been tested, and 922 from the contact tracing were positive. And then, so if you look at mandatory quarantine, 2,022, and there's 115 positive.
So of the list you've just read out, narrated, for me the most important bit there is the routine. What do they mean by routine tracing?
No, routine surveillance.
Okay, so routine surveillance. So is it that people have walked in? Because you see,
no, there is this thing. People when they identify that in this area,
have said, I'm not feeling well.
This area, people are testing positive. They are doing what they call random sampling.
Okay.
So they can just come 2, 3, 4 houses and say, because the disease, somebody has tested positive, we are coming to test people in this house.
Okay.
That's what they are calling the routine surveillance.
No, but is that not a part of enhanced?
Yes,
enhanced contact tracing.
That's on
because
the
if you go into a center,
contact tracing is when you test positive and you got in contact with somebody, and that person also was found to test positive. It's even those who have actually arrived from the country, all their contacts have been traced already.
So that's why
I call it enhanced contact tracing.
Okay, Elvis. So for me, on that batch, it's as if we are waiting for it to come to us.
Yeah.
I am looking for the next phase where we go chasing the virus. We don't wait for people to come to us.
But chasing the virus is what we are doing with the enhanced contact tracing.
Yes, but how are we doing that enhanced contact tracing?
This is how you are doing it. Maybe I brought the disease. I got in touch with David. David was tested to have been also positive. Then David, whichever people he also got into contact with. So the tracing keeps going on. That is what is happening.
So I think your problem is that you should basically
but then if you have any of the symptoms.
What I'm looking for on the second phase is to chase the virus. How do you do that? I would have loved us, if possible, to set up testing booths, especially in Greater Accra, because we have a higher percentage in different areas. So you go to Oxford Street, then you have a testing booth there. Anybody walking, we can call you in and test you.
So that's a Senegal strategy.
Well, whatever the case is, we should move a step further, aggressively chasing the virus.
You can only do that when you have rapid test kits.
Well,
and you have an overabundance of them.
So, as the president rightly said, the war is not over. What is the next phase of the war?
Yeah.
What is the next phase of the war? We have been able to stabilize our artillery. We've been able to bring in the kind of guns that would help let the enemy go back, but the enemy can still infiltrate. What kind of artillery are we bringing in to stop the enemy even advancing?
Okay.
That is my challenge.
Okay.
And I believe that the next phase, I hope and expect that the next presentation the president gives, he tells us how we are aggressively attacking the virus.
Okay.
We don't wait for people to come and tell us we are not feeling fine, we are not doing this, or we feel that we are coughing and all that. No. Let's set up all these things in lorry parks. Before you board a VIP bus, you are tested. Before you board a trotro, you are tested. Before you board STC, you are tested.
Yeah.
Before you walk into a shop, you are tested. Then it will give us a clear picture of how we should look at this virus. Because, you see, the danger here and the danger for most countries in the world is recurring. As we see, China seems to be experiencing that. Some other countries were experiencing that. We can't afford that to happen. But I can say, if it recurs, we would have experience from the initial influx of the virus. So we probably might be able to handle it well. But equally, what am I doing? Right now, what am I doing?
Pointing?
I'm pointing a finger at you. 1, 2, 3 is pointing back at me. So for me, in as much as government is putting things in place, the responsibility of being able to eradicate COVID-19 relies on us.
As individuals.
Relies on individuals. If government is putting in place the directives, the measures, things we need to do. Because today, as I was coming, I saw people without masks. Some of the trotros that were standing at traffic lights, a lot of people weren't wearing any masks. And if the government says, wear mask, it helps, and they are not doing it, how do we expect to be able to eradicate this virus?
Well, I mean, to be fair, the assemblies now are become proactive. Right now, everywhere in Accra, all shops and places of public access have been instructed to put signages up and actually turn people away if you're not wearing masks. So you can't go into a shop now. I know over the weekend I went into a couple of shops. You can't get in if you're not wearing a mask.
Good. David, that is good.
So it's
David,
a developing situation.
Mine is those walking on the streets. Go to Tudu. People walking about. Go to just up here near the MTTU. People are walking about. Places like that. People walking on the streets. Even in front of your television station here, when I was sitting in the car waiting to come up, people were walking about without masks.
And even this mask, they say, but the maximum is twice and throw it away.
Yes, throw it away.
Now people are wearing it for a week.
Yes.
2 weeks. They are,
You see, David.
You are assuming that they're wearing it for a week.
David.
I'm telling you, people I know who are wearing
somebody's wearing a mask for a week.
I know people who are under. I'm telling you.
David, you see, the other thing for me is that before the president comes and says anything to us, especially with this mask situation, there are plans well advanced to distribute. Because one of the reasons why he decided to lift the lockdown was the fact that it was having an impact on those who have to eat every day hand to mouth.
Yeah.
Where do you think these people hand to mouth will get money to buy a mask?
Okay.
If you're saying that
I want you to also
buy.
comment briefly on the extension of the ban on public gatherings as well, just briefly before.
I think that is a good thing. I think that is a good thing. That's why maybe we'll come to it. I don't seem to.
No, you comment on it now.
Okay, all right. I think it's a good thing. It doesn't spoil anything. And rightly the president said the war hasn't ended. And so I would even expect after the 2 weeks, he extends it to another 2 weeks.
Okay.
It would also be good if he says, look, for the next month, nothing. So that he doesn't always have to extend.
Yeah.
Because really, what is it? What are the public gatherings? Funerals? Churches? And look, there are new ways of going to church now. Although some people seem to think that the effect of it, you don't feel that tactile effect of it. But hey, I believe that worshiping God is inside of you.
Yeah, but church is not only for worship, it's also for fellowship.
Well, it's also for fellowship.
Yeah.
But if fellowship is going to spread the...
Exactly. So
then there's no need. So I think it's a good thing. And I think that should be the last thing that he lifts. Now, you then ask the question, with regards to the borders, if gatherings and all that is still in place, what about the borders? Because I drove through about 5 hotels on Sunday. They were all closed. Golden Tulip. All of them, they were all closed. That goes to show you the effect of the border closure. When then should that be open? And the moment you open the borders, then you might as well open everything. That is a challenge that can also determine some of the things that can happen in the economy.
Okay.
So I think on the whole, yes, we should continue with the closure of gatherings and all that, and monitor it as we go along. But I would have loved it to be for a month so that people can plan properly and know that by the end of this month, we would have surpassed the challenge and we can open up those areas that have been closed.
The extension.
No, I think it's in order. I think it's in order, but I think one of the things somebody raised, and I think maybe the government needs to look at, is about conferences that people want to hold. And sometimes their conferences are not about large gatherings.
Yeah.
Maybe 40 people want to have a conference, and the conference what they are going to use is so big that they can have good social distancing. Do we have to continue to keep a ban on such? So I think that those things are very important. And then, in terms of the borders, I think that we have learned a lesson from quarantining people before closing the borders. I think that we should extend that lesson to if we are going to open the borders.
Yeah.
Because WHO has warned that no study, it has not been established that even if you recover from the disease, then you are immune. So that is why we are seeing reoccurrence of the disease happening in other places. So if we are going to reopen our borders for people to come in, then probably we should be considering bringing in rapid test kits and also have an arrangement where people will still be quarantined where they want to come and do business in Ghana. So if you are coming to do business, come 2 weeks ahead of time because you'll be quarantined. And you pay for the quarantine yourself.
Yeah.
If you're not willing to pay for it, don't come.
Okay.
So that you do your own arrangement for your quarantine, you pay for it.
All right.
So that we make sure that we don't import the disease back into the country.
Okay.
I'm sure that if we reopen with that, it will be in trouble.
All right. So I want you guys to comment very quickly, just a minute each, on the issue this weekend as far as the NDC supporters discovering that something untoward was supposedly going on with the EC.
There was nothing was supposedly going on, so don't even go there. It has been established that whatever reason they claim that they went there did not exist. Why should we encourage lawlessness? It's total lawlessness. We shouldn't encourage it. Sanjay went to court because he doesn't want to be lawless.
Yeah.
So if there is any evidence that EC had broken the law, I think the best place for him is to go back to the court, not organizing tax and people to go to the place. We shouldn't encourage that. If he was able to go to court to secure an injunction, he should know that if the injunction is defied, he can still go to court to seek punishment, not organizing people to go there. We shouldn't. I will not encourage that.
A minute's comment.
Nobody knows why the EC decided to go to that particular hotel where the injunctions was placed on it.
It actually was placed on the
They said there was no workshop. There's a routine of duty.
Well, that is what they were saying. We weren't there. But I believe that if it's a routine thing, they can hold it at the EC offices, can't they? They have a conference room in the EC office. They can do that. So, really, I don't think it was necessary for the EC to allow others to create this kind of, dissatisfaction.
Okay, all right.
I would have loved that they didn't even go there.
All right. Thank you. So quickly, let me just read through. I want to say a big thank you to all my guests, both of my guests. Let me quickly read through some of your messages that you've sent through. This is coming from Positive Change in Medina. He says, we don't eat roads, we don't eat hospitals, we don't eat infrastructure. Today, Ghanaians have realized how we eat those things. Free SHS is sitting at home, 1D, 1F is idling in the bush. 1V1D is swimming in the dugouts, planting for food and jobs has been exposed. NAPCO is sitting at home. All right. Ibrahim Gariba says, thank you, Mr. President. The battle is the Lord's indeed. Together we shall overcome. God bless our motherland. And Daniel Ando says, book long. Every face mask can protect their mouth and nose. Okay, I think he's referring to you. Zoom.
You should go and read about
Zoom
it.
K
The
says
mask.
things must change. We are not in normal times. Let me just read quickly one more. Abdul Basit. He says, good morning to my able information minister, Kojo Nkrumah, and fellow Ghanaians. Happy Ramadan to all Muslims in Ghana. Let's keep washing our hands with soap and water. Stay home, stay safe. We should kill the virus. Thank you very much for that. There's so many more messages. Keep your messages coming through. We have to go now. But I want to say a big thank you to Elvis Darko, who's the editor of the Finder newspaper, and also to Kwame Jantuah, who is a lawyer and the former vice chair of PIAD.
And a member of the CPP.
And a member of the CPP. Yes, so thank you very much.
Hi, I hope you enjoyed the show. Do not forget to subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.